Today we're going to be conducting goniometry of the hip. So we're starting with hip flexion, which is a normal range of 120 degrees, and we need an end feel of soft due to muscle bulk, or it could be firm due to the posterior joint capsule. Our landmarks are going to be at the greater trochanter for the fulcrum. So palpate for the fulcrum. Palpate the greater trochanter, put the fulcrum there. Our distal arm is going to be on the lateral midline of the femur, and our proximal arm is going to be on the lateral aspect of the pelvis. You would like to make sure that you put the patient first in passive range of motion to get the end feel. And then you could just measure it from there. Oh. Get 102 degrees. The landmarks are the same for hip extension. Ask your patient to please lay on your stomach, sir. So again, the fulcrum is going to be at the greater trochanter. End feel should be firm due to the anterior joint capsule. Same thing at the greater troch. You're going to have your distal arm on the lateral midline of the femur and your proximal arm at the midline of the pelvis. And you want to make sure there is no anterior pelvic tilt, so you can stabilize at the pelvis. And same thing for hip flexion. You want to make sure there is no posterior pelvic tilt, so you want to make sure you're stabilizing firmly at the pelvis. Sometimes it's required for two clinicians to do the work, so one could stabilize and another one can measure. So for this one, same thing. We're going to just bring that leg up. We should have about 20 degrees of extension. Okay. We got 15. Okay. Pause. All right. For our next Goni test, we're going to be doing hip abduction and adduction. So the fulcrum, proximal, and distal arm are all the same. Having your patient lying supine, we're going to palpate approximately where the AIS, anterior superior iliac spine, is, and that's where the fulcrum is. And then our proximal arm is going to be an imaginary line connecting to that other ASIS, and our distal arm is going to be on the anterior midline of the femur, and you could use the patella as reference, and you want to palpate the patella to make sure there are no abnormalities with it. So our end range should be firm due to the inferior joint capsule. The range varies usually, but it's usually about 20 to 45 degrees. So it's going to look like this. we got 40. And for adduction, same thing, same landmarks. Put the fulcrum on the ASIS, imaginary line, anterior midline of the femur, patella as reference. It's also going to be firm and feel due to the superior joint capsule, and range should be about, I believe, let me see, 20 to 25 degrees. I'm just going to measure real quick. Okay. We got 15. Possible. An internal rotation and external rotation of the hip. For landmarks, you want the fulcrum to be at the patella. Your proximal arm is going to be perpendicular with the floor, and your distal arm is going to be at the midline of the tibia. You could use the tibial crest or the midpoint between the malleoli for reference. Normal range is 45 degrees, and feel should be firm. The firm and feel is due to the ischiofemoral ligament and the posterior joint capsule. Okay. Got about 32 degrees for internal rotation, and for external rotation, same landmarks. On a side note, if there is a femur discrepancy, you would want to use the prone alternative position. So again, fulcrum at the patella, proximal arm perpendicular to the floor, distal arm at the tibial crest. We're just going to bring it in like this. We got 35 degrees, right? Yes, 35 degrees. And you want to make sure that the end range is also going to be firm. The end feel is firm due to the anterior joint capsule, the iliofemoral and pubofemoral ligaments. And that is all. Thank you.